Hey guys, Dr. Robert Wolkers here with Haymarket PT, and this is Cameron Lewis, our wellness coordinator. And what we're going to be going over today, I know you guys have been watching the Olympics, we have a lot of patients coming in asking about it. So we've been doing cupping here at Haymarket PT for quite some time now. So it's a really cool technique that's going on. It's getting a lot more press because of all the Olympic athletes showing up with all these red marks and bruises all over their shoulders, their backs. So what we want to take you guys through today, basically I'm not really going to get into too much about the physiological part of it, the research. I just kind of want to show you the technique that we're doing here at PT. Cameron, if you remember from our last video, had some neck, some upper back pain too, limiting his shoulder range of motion. So what we're going to do today is just kind of add a little bit to it with the cupping technique. The best way we could kind of describe the cupping is that you put it on the skin, you use this little, I guess it's an air gun to kind of pull the skin up. There's different levels here on the cupping device. You'll see a lot of the athletes in the Olympics kind of really getting up here on that top line. We usually just go a little bit above this first line just to start, just so it's tolerable to the patient. And what it does is it's going to lift the skin, the fascia underneath. It's going to bring in blood flow to the area. And then that's kind of where the research gets a little tricky. So there's not a lot out there to determine the physiological behind it, and then the benefits to the patient. The best way we could kind of describe it here at Haymarket PT is that if you go to like Ruth's Chris Steakhouse and you get like a really nice juicy steak, you get the mashed potatoes, the green beans, and everything there. We'll consider that like your whole plan of care. The cupping is like the parsley, the garnish on top. So if you're just coming in to get cupped, you're probably not going to get the benefits that you would see if you actually got like the whole meal on top of it in the whole plan of care. Kind of like dry needling. So dry needling, if you're coming in just to get needled, you're probably going to want to get some manual therapy, get some exercises, go from there. So it's the whole plan of care. It's just not one technique that's actually going to help and be beneficial to you. Today we're going to show you 3 techniques that we use. The first one is going to be a static cupping, which is what most of the athletes are seeing is getting, the cup, they're just going to leave it there, kind of like a set it, forget it for about 5 to 15 minutes. The other one that you're going to see is going to be a technique where you put the cup on and you're kind of gliding it over the skin, some of those areas. And then the last technique that we're going to do is going to be, doing the static cupping, but then Cameron's going to be doing a couple different movements with it. So one cool thing about the cupping, a lot of manual therapy techniques is compressive. So you get a lot of them. They're doing a soft tissue massage. They're pushing down, they're compressing the skin. You might see the Graston tools, you might see gua sha tools, which are another different technique where they go in and they start to try to increase blood flow that way. They try to get the soft tissue work going. This is actually decompressive, so you put it on the skin and it's going to pull the skin up, so it's decompressing the area. One thing that we're seeing really cool results with the cupping with is for shoulder mobility around the back side of the shoulder blade, and a lot of plantar fascia. So we put the cups on the bottom of the foot and then decompress the bottom of the foot where the plantar fascia is, and a lot of our patients are seeing some pretty cool results with that too. So first thing we'll do, Cameron's going to pop his shirt off here, and then we're going to work on the static cupping first, okay? So Cameron, go face down on the table, and then we'll go up here. So Cameron has been having some pain up around the right shoulder here on this side. Basically where the paraspinal muscles are coming through, posterior rotator cuff, his lats coming up and around, and then even this upper trap's been locked up. So last time you saw us kind of do a technique where he was laying on his back. We kind of did a maneuver there to kind of free up some space around the shoulder blade, up and around his neck. But today with the static cupping, I use a little bit of ultrasound gel just to kind of get a little bit more suction out of the cups itself. As you can see, like this big ridge right here, where he's really built up, a lot of tension through there. So I'm going to get the cup here, I'm going to go right on that area, and then I'm going to give him 1, if not 2 pumps. So you can see the skin kind of lifting up there. I'm going to bring it up just to the point where it's above that line. And then I'm going to bring this one over too. We're going to go a little bit spacing here, a little bit higher. Same thing, pump. Now you can see the skin starting to pull up and lift in. So it's going to really get on that area there. That looks good there. I'm going to drop another one in on top. Cameron, how's that feel?
This feels tight.
Okay. And any pain with it?
No, just a pull.
So a lot of times patients will say it's just a pull. They're not going to get too much pain or discomfort with it. They're going to feel it's just a pull. Sometimes it's one of those, feels so good or hurts so good kind of sensations. It's just different. It's going to be a different kind of sensation that you've ever had because it's more decompressive. So you're going to go just like this. One more here. We're going to load it on. And as you can see, so Cameron's already starting to get really good blood flow coming through. As far as the cups go, this is why you're going to start to see those red marks on them, because basically you're adding suction to the skin. Those blood vessels are starting to break down a little bit. You're starting to get a capillary response. And then we're going to leave that there for 5 to 10 minutes. Okay. For the sake of this video, I'm not going to leave them on that long. So this is the first one that we do. We just leave them here. Okay. And then we would have Cameron do some range of motion strengthening exercises once they're off in order to start that process. Okay. So I'm going to just pop these off here. You're going to see a little bit of just from being on there for 30 seconds. Okay. You're already going to start to see some kind of bruising back here from it. Normal. You can see when I pull them off, the skin starts to release. Okay, so it starts to release that area. And then as you can see, the different markings here from the cupping. And then basically, what you see is now they're starting to go away. Once that capillary response goes, now you might get some staining there that might last him anywhere between 24 to 48 hours. Some people, if they do a really hard cup, this might last, almost a week to 2 weeks sometimes with the cupping. So what we're going to show you next, just add a little bit more cream here, a little bit more ultrasound gel, and then I'm going to kind of come up into this area where he's kind of, when he lifts overhead, he's limited at that end range of motion, shoulder flexion, lifting the arm up. So we're going to come right in this area here. Going to make sure I have a nice smooth surface. Now I'm not going to cup too hard because I want to glide. So I kind of get right in there, and then we're going to start to glide the tissue. Okay, we're going to come right down here on the lat, coming all the way down to the back area here. If there's a little bit of a ridge or a hump, sometimes you might break the suction, so you just reset it. And then we're going to go just like this. And then how does that feel, Cameron?
It feels just like you're rubbing it.
Okay, so feels like I'm giving him a soft tissue massage. I'm kind of going this way, going all the way through. The only thing now, I'm lifting up, and then I'm using this device here in order to really get in there and then really break up some of that. How's that feel, Cam?
It feels like a rub, but I can definitely feel the suction.
Okay.
Just feels like a lift.
Not as bad here. You're going to start to see some, capillary response. You're starting to see the blood flow coming through the area, but it's not going to be as aggressive as it was with the static cupping, okay? Unless I really give him a hard pull here, then he's going to start to feel it a little bit more because you are adding some a friction component there to the skin, which could be uncomfortable, but that's why I like to use the cream. I get that just so my cup glides a little bit more so he doesn't feel me really kind of just adding friction to it, pulling out. I use the cream just to get a nice glide going in through the tissue, okay? Cool, so we just go just up and down. We could do the lats here. You could come up in through the top of the shoulder area and then go from there. So, really nice technique all on the back side of the shoulder here. So now what I'm going to have Cameron do, just for the last part, is he's going to kind of go on all fours, which is neat. I'm going to use 3 of these guys here. So what we're going to do is we're going to cup them from the static cupping again. So like we just talked about here, where we're going to put these guys back on just to really set the lat. And we're going to bring them down a little bit more. And I'm going to drop one up on his upper trap too, just so he doesn't get too much response there. Cool, so we got just like that, all right? And then I'm going to come up and put one smaller guy there. There's different sizes. These are the bigger ones for the back. And then this one here is a little bit smaller, so I'm going to kind of get right up on that upper trap, levator scap area, where he's going to have some issues at. Give him one there. Good. So now what Cameron's going to do with movement is he's going to take his arm here, and then he's going to bring it up and then overhead, just like a swimming position. So he's going to bring it back down towards his pocket, and then he's going to bring it up, and then he's bringing it back out. Nice stretch at the end. So he's going to come back here, bring it all the way out, nice stretch. He's getting good movement. So you know what we're seeing here, that shoulder coming up towards the ear. He's starting to get a little bit more of a stretch there. Right at the end, give him a nice little pull, come back down, up and in, perfect. Give him a little stretch, bring him back down, bring it all the way up and over. Hold it, 3, 2, 1, and relax. You know, and you've seen a really good response back there on the lats as far as the cupping goes. How does this feel, Cam?
I definitely feel the one on my mid back when we pull it through, and it's where it's tight. You definitely feel it pull more when it gets tighter.
Okay, and then we're going to go one more, buddy. So then we're going to come all the way up here. We're going to hold it, 3, 2, 1, and then relax. Good. And then Cam's going to go just back down on his stomach. We would do a couple of different repetitions to that. You know, a couple different sets. Let them set. I'll keep an eye on the cups if I feel like they're turning, you know, a different color than I would like to see. You know, I would take them off and then reset them so that they're not as much as the suction. You know, seeing these responses, they make people kind of cringe a little bit. But honestly, especially down here where he was really pulling, you know, getting a little bit more of a response. You know, down here where he's a little bit more tighter at. These ones up here are already starting to go away. So as you can see, kind of where a little bit more of his issue was, just on that ridge like we were talking about, which was good. And now if he has a seat here, okay, and then what I'm going to do is we're going to just kind of check his range of motion. So what you didn't see when we first started, so camera when we measured was about 165, 170 degrees range of motion. And then he's going to go back up here. You know, he's coming up pretty good. How's that feel, Cameron? A little bit better?
Yeah.
So it's coming up. We're getting some nice movement here at the shoulder blade. You know, it's supposed to come up and out. So he's no longer adhered to the back where the thoracic spine is. He's coming up here overhead. You know, active range of motion. He's coming right up towards his ear. I'm able to give him a little bit more of a passive stretch past the ear. You know, getting up to that 180 mark that we all, you know, like to get to, and then the scapula is really returning nice, which is good. So how's that feel, Cam?
Biggest difference is before, when I would raise my arm, I would definitely feel it in my mid-back, thoracic, but definitely now I'm feeling it more in my lats because we didn't really work on those, but the back is released.
So, and then that's a common thing that you would hear with the cupping. A lot of times, or even the dry needling too. People will say like, hey, you know, where you did it feels really good, but now I got areas that you didn't cup or didn't needle that, you know, still need to get worked on. So if we just cupped Cameron and just, you know, let him go and, you know, he came in, cupped him, and then he was on his way, he wouldn't get the benefit if he was doing the cupping. You know, then you go to progress to manual therapy, stretching, then you get the exercise on the backside, and then his home program so he knows what to do at home. That's the whole plan of care. That's the whole, like we talked about, you know, getting the whole steak, eating it, not just getting the garnish, okay? So what we would do next is cup them on the outside here, work on this a little bit more. You know, as you can see, camera's gonna turn for you guys. You know, doesn't really have anything over here. We didn't do too much over here. We just did the back. So the next part of it will be coming up and through here, you know, doing soft tissue work there, maybe even the cupping to get that freed up a little bit, just to get them, you know, firing a little bit more. And then don't forget, just because the back, you know, also want to work in the front here, rounded shoulder. You want to start getting this pulled back a little bit too, start getting this a little bit more pressure off the joint, bringing him back, so that way he gets really good range of motion going up, and he's able to do his lifts, you know, at the gym, you know, power cleans, all that stuff, without really having to worry about that shoulder instability. So hopefully you guys learned something today. That's cupping. It's a really nice technique. There's going to be probably more research coming out now that it's got a little bit more in the spotlight to it. You know, understand that the research to it is a little bit limited at the moment, but it has been around for a very long time. It's not a new technique. It's just a little bit more in the media these days. So if you have any questions or concerns, you know, shoot us an email, and we look forward to talking with you guys again. Thank you.